Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Dr. Amy Leigh Overton-McCoy, and she is the director of the UAMS Centers on Aging, a geriatric nurse practitioner, and a doctorate of psychology. Dr. Overton-McCoy, thanks for being here.
Thank you. It's a real honor to be here.
So we're talking about the Center on Aging. Tell us what that is.
Well, the UAMS Centers on Aging consist of 8 locations. It actually has 7 throughout the state of Arkansas, covering every county across the state of Arkansas. The 8th location, of course, is at the UMS main campus here in Little Rock. And our mission is to improve the quality of life of older adults. Of course, it is to improve that quality of life. Of course, we don't start aging at some magic number of 55, 65, 50, whatever age we want to identify. We start aging the minute we're born. And it is something that we want to age well. So we work with all ages to be sure that we do age well. Of course, for those of us that may have chronic illnesses, we also work with individuals how to manage those chronic conditions better and work with their families and healthcare team in a holistic manner.
So what are some of the most significant challenges facing older adults in Arkansas?
Well, Arkansas is a more rural state than a lot of states in our nation. And so social isolation is a big problem that our older adults face. And so keeping connected is a real challenge because of depression will set in. And we have a higher suicide rate among older adults than most states. And as this isolation, we have less transportation in the rural areas than other states. And so when you have less transportation, then you have higher food insecurity. Well, that's a basic need. And that affects other health outcomes. If you're not having access to your basic needs, then you're also not having access to proper health care. And it just has a ripple effect. And if you're isolated to food and access to health care, you're really cut off. And the younger generations are moving out of rural areas. Families are moving away and they're leaving older adults behind. And this is a real problem that our older adults are facing. And so communities are so important to our older adults. And so that is one area. The Centers on Aging is so vital to our state.
So what does that mean when you say the centers are vital to those rural communities? What do they do? They implement programs, work with different grants? How does that all work?
So the UMS Centers on Aging, these are the state tobacco settlement funds at work. So that's really important to understand. These centers could not exist without those master tobacco settlement funds. And they create and utilize programs to help older adults do wellness programs. And they are totally free, no charge to the community at large, as well as caregivers. So they learn how to take care of their loved ones, participate in physical activity, healthy cooking classes, how to maximize their budgets, Medicare wellness programs, sign up for their Medicare programs, anything that community needs. The other thing is resource allocation. Our goal is not to bring everybody to Little Rock. As I said, we cover every county in the state. We want older adults to have the opportunity to stay in their home. So we utilize technology, and we understand there are gaps of technology, broadband, cellular service. So we're always creating innovative models with other partners, whether it's partners within UMS or partners outside of UMS. We're always looking for additional partners, and we are finding the partner within the community to leave older adults within that community so that they can stay where they want to stay. And so that is the key, is that we're finding what is the most successful entity to leave that individual where they can age well, and working with that partner so that they can have successful aging.
And the center addresses issues, and you touched on this a little bit. So it's beyond healthcare access, like mental health, also social isolation. I mean, all of those kind of come into play with this.
Absolutely. It's everything. It's a very holistic aspect. It is mental, physical, social, spiritual. It is everything wrapped up in one. It is not just one aspect.
And does telemedicine come into play, telehealth with this too?
Yes, we work very close with digital health. In fact, in 2009, we started the very first geriatric telemedicine model, way before COVID ever became a buzzword and telehealth became popular among older adults. And so it works. What we're finding, though, digital literacy is a challenge among many older adults. And so it is something that requires patience. It is something that requires ongoing teaching. And so it is something that we are skilled in doing and working, and we know that because of different reasons, it does require ongoing teaching. And so we are working particularly with homebound individuals so that they can have the opportunities to participate, whether it's physical activity, healthy cooking class, or connect maybe to caregivers into other states so that they can still have that connection and stay in their own homes. And so providers, even on UMS campus, can connect to older adults in the rural areas and don't have to make that long journey. And so telemedicine and telehealth both play a very important part for our rural Arkansas and older adults across the state.
And how important is it for communities to support the aging population, and what role do local organizations and businesses play in this?
Well, the connection is so important, as I mentioned, and so communities are key. So whether it is that faith-based or social organizations and our businesses is so vital, and intergenerational programs is also key. And, you know, our students, as we're talking about technology literacy, students, if they're looking for perhaps volunteer opportunities, we would love to visit with them because they could mentor, and perhaps our older adults could help share their wisdom with the youth of today, and the youth of today could share their technology wisdom with our older adults and have mentor opportunities for both of them. And that is a great way for both of them to learn from each other and grow our workforce in healthcare professionals across our state, and particularly in our geriatric healthcare workforce, as we are only all going to age if we have the blessing of that opportunity.
Where should community groups, those that want to get involved in these programs, where should they go? How do they get involved?
Well, there are 7 centers on aging across the state of Arkansas. So the local level is a great opportunity to get involved on that local level. For instance, if they wanted at Fort Smith, they could contact the Fort Smith, which is West Central Center on Aging, and they cover 15 counties. And you could go onto our website, which is UAMScentersonaging.org, and it has all of the centers located there. There is even the coordinating map with each center location, coordinating with their phone number, staff listed out by each center with their phone numbers. And they could call and coordinate an appointment, or even call just to talk to that staff and coordinate a time, talk to them, visit with them, and see how they could provide an opportunity to volunteer or even schedule different programs. There's a list of programs that we provide. Of course, it's not all inclusive. We provide many other programs. That's just kind of gives an example. There's also a calendar of events. Just because it might say, for instance, Texarkana, please know that they can participate from Jonesboro or Piggott, Arkansas, or Walnut Ridge, because we have virtual programs for everything to include those homebound individuals, or if they're traveling. We do not publish Zoom links to protect everyone, but if they call, we will send those links to them.
And is it free to where anybody can join and be a part of it?
Absolutely. They are all free. We do not charge for any of the community events.
And what are some of the most effective ways we can break the stigma associated with aging?
I think to know that, again, if we all have the blessing or pleasure, we're all going to be there one day. That's the most important. And to stop and get to know someone. Aging is really a blessing and something we should celebrate.
It is a blessing. I don't mind the birthdays because it is a gift.
It is a gift.
And what advice do you have for families and caregivers of older adults who may feel overwhelmed?
Please know you're not alone. You're not alone, and there is so many caregivers out there that are feeling exactly what you're feeling. And we have many support groups and options, and education is power. And when you're in the middle of the crisis, the last thing you feel like is you have time for education, but we can provide it to you in short stints, even in one-on-one caregiving coaching, and provide it even in virtual options. So that alone, giving you those short opportunities to provide you those strategies to where it does not seem so overwhelming, can be a game changer for you. And we're going to focus on what is the overwhelming obstacle at that moment. And we can even provide it in settings that it's for the family and not necessarily in group settings. So if you have a family of 5 or 10, we can just provide it just for that family and give you solutions to what is that challenge at that time. So it is endless, as well as we can give you those local support options so that you know what's right there in your backyard that you may have not known that's there. And that also is a great option. Just knowing what is there is a great relief, knowing there's somebody else there for you.
Somebody else there for you, and so good to know that you have to take care of yourself before you can take care of someone else.
Absolutely.
So it's nice that those resources are there. So before we leave and close, what message would you like to leave about aging and the importance of supporting older adults in our communities?
You always have support. The UAMS Centers on Aging is there for everybody. Whether you're young or old, there is support, and you can age well. It's not the stigma that everybody thinks of or the stereotypes. You can age well, and that is what we're there for. But if you've not been blessed to age well, it's not too late to change your habits and to manage that chronic condition in the most effective way. We can give you those strategies, and we can do it all free and help you work more efficient with your healthcare team and your family and keep you in your home or in your community as long as possible. And that is what the UAMS Centers on Aging is all about.
Well, thank you, Dr. Overton-McCoy, for talking about this important information and for all that you do for those in Arkansas.
Thank you. Thank you for allowing me the opportunity.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.